Alendronate. Alendronate is used to treat and prevent osteoporosis, a condition in which the bones become thin and weak and break easily. In women who have undergone menopause, change of life, end of menstrual period, and to treat osteoporosis in men. Alendronate is also used to treat osteoporosis in men and women who are taking corticosteroid. Al- uh, Alendronate is also used to treat Weakest disease of bone, a condition in which the bones are soft and weak and may be deformed, painful, or easily broken. Alendronate is in a class of medications called bisphosphonates. It works by preventing bone breakdown and increasing bone density, thickness. How should this medication be used? Alendronate comes as a tablet and effervescent tablet and a solution to take by mouth. The solution is usually taken on an empty stomach once a week in the morning. The 5 mg and 10 mg tablet are usually taken on an empty stomach once a day in the morning, and the 35 mg and 70 mg tablet are usually taken on an empty stomach once a week in the morning. The 40 mg tablet are usually taken once a day in the morning for 6 months to treat Paget disease of bone. The effervescent tablets are usually taken on an empty stomach once weekly in the morning. Follow the direction on your prescription label carefully and ask your doctor or pharmacist to explain any part you do not understand. Take alendronate extractly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. Alendronate may not work properly and may damage the esophagus or cause sores in the mouth if it is not taken according to the following instruction. Tell your doctor if you do not understand, you do not think you will remember, or you are unable to follow this instruction. You must take alendronate just after you get out of bed in the morning, before you eat or drink anything. Never take alendronate at bedtime or before you wake up and get out of the bed for the day. After you take alendronate, do not eat, drink, or take any other medicine, including vitamin or antacid, for at least 30 minutes. Do not lie down for at least 30 minutes after you take alendronate. Sit upright or stand upright until at least 30 minutes have passed and you have eaten your first food of the day. If you are taking the alendronate tablet, swallow the tablet with the full glasses of plain water. Never take alendronate tablet with tea, coffee, juice, milk, mineral water, sparkling water, or any liquid other than plain water. Follow the tablet rule. Do not spill, chew, or crush them. Do not suck on the tablet. If you are taking the alendronate oral solution, drink at least 2 ounces of water after taking alendronate oral solution. Never take alendronate solution with tea, coffee, juice, milk, mineral water, sparkling water, or any liquid other than plain water. If you are taking the alendronate effervescent tablet, dissolve on effervescent tablet in a full glass of plain, non-carbonate drinking water before drinking. Never dissolve alendronate effervescent tablet with tea, coffee, juice, milk, mineral water, sparkling water, or any liquid other than plain water. Wait at least 5 minutes after the effervescence stops. Stir the solution for 10 seconds and drink it. Do not swallow, suck, or chew on the effervescent tablet. Alendronate controls osteoporosis and Paget's disease of bone but does not cure this condition. It may take 3 months or longer before your bone density begins to increase. Alendronate helps to treat and prevent osteoporosis only as long as it is taken regularly. Continue to take alendronate even if you feel well. Do not stop taking alendronate without taking to your doctor, but talk to your doctor from time to time about whether you still need to take Alendronate. Ask your pharmacist or doctor for a copy of the manufacturer's information for the patient. Other uses for this medicine. This medication may be prescribed for the other users. Ask your doctor or pharmacist for more information. What special precautions should I follow before taking Alendronate? Tell your doctor and pharmacist if you are allergic to Alendronate or any other medication. Tell your doctor and pharmacist what prescription and non-prescription medication, vitamins, natural supplement, and herbal products you are taking or plan to take. Be sure to mention any of the following angiogenesis inhibitors such as bevacizumab, everolimus, pazopanib, sorafenib, or sunitinib. Aspirin and other non-steroidal anti-inflammatory drugs, NSAID, such as ibuprofen and naproxen. Cancer therapy or oral steroids such as dexamethasone, methylprednisolone, and prednisone. Your doctor may need to change the dose of your medication or monitor you careful for side effects. If you are taking any other medication, including supplement, vitamin, or antacid by mouth, take them at least 30 minutes after you take Alendronate. Tell your doctor if you are unable to sit upright or stand upright for at least 30 minutes. If you have or have ever had a low level of calcium in your blood, a risk breathing in food or fluid into the lungs, or if you have any problems with your esophagus, your doctor may tell you that you should not take Alendronate. Tell your doctor if you are undergoing radiation therapy or if you are on a sodium resistant diet, and if you have ever had anemia, a low level of vitamin D in your body, difficulty swallowing, heartburn, ulcers or other stomach problem, cancer and type of infection, especially in your mouth, problems with your mouth, teeth or gums, any condition that stop your blood from clotting normal, or dental or kidney disease. Tell your doctor if you are pregnant or are breastfeeding. Also tell your doctor if you plan to become pregnant at any time in the future, because Alendronate may remain in your body for years after you stop taking it. Call your doctor if you become pregnant during or after your treatment. You should know that Alendronate may cause osteoporosis of the jaw, especially if you have dental surgery or treatment. While you are taking the medication, a dentist should examine your teeth and perform any needed treatment, including cleaning or fixing filled dentures before you start to take Alendronate. Be sure to brush your teeth and clean your mouth properly while you are taking Alendronate. Take to a doctor before having any dental treatment while you are taking this medication. You should know the Alendronate may cause severe bone, muscle, or joint pain. You may begin to feel this medication within days, months, or years after you first take Alendronate. All throughout, this type of pain may begin after you have taken Alendronate for some time. It is it is important for you and your doctor to realize that it may be caused by Alendronate. Call your doctor right away if you experience severe pain at any time during your treatment with Alendronate. Your doctor may tell you to stop taking Alendronate and your pain may go away after you stop taking this medication. Take to your doctor about the things you can do to prevent osteoporosis from developing. Neurosis. Your doctor will probably tell you to avoid smoking and drinking large amount of alcohol and to follow the regular problem of weight brain exercise. What especially dietary instructions should I follow? You should eat and drink plenty of food and drink that are rich in calcium and vitamin D while you are taking Alendronate. Your doctor will tell you which food and drinks are good source of these nutrients and how many serving you need each day. If you find it difficult to eat enough of these food, tell your doctor In that case, your doctor can prescribe or recommend a supplement. What should I do if I forget a dose? If you miss a dose of once daily alendronate, do not take it later in the day. Skip the missed dose and take one dose the next morning as usual. Do not take a double dose to make up for a missed dose. If you miss a dose of once weekly alendronate, take the dose the morning after you remember when return to taking one dose once each week on your regularly scheduled day. Never take a double dose to make up for miss and never take more than one dose in one day. What side effect can this medication cause? Alendronate may cause side effect. Tell your doctor if any of these symptoms are severe or do not go away. Nausea, stomach pain, constipation, diarrhea, gas, bloating or fullness in the stomach, change in ability to taste food, headache, dizziness, swelling for the joint, hand or legs, muscles, cramps, twists or cramp. Some side effect can be seriously. If you experience any of following symptoms or those listed in the special precaution section, call your doctor immediately before you take any more alendronate. Now, ocean heartburn, difficulty swallowing, pain on swallowing, chest pain, bloody vomit or vomit that looks like coffee grounds, black tarry or bloody stools, fever, blisters or peeling skin, rash, itching, hives, swelling of eyes, face, lips, tongue or throat, difficulty breathing, hoarseness, painful or swollen gums, loosening of the teeth, numbness of heavy feeling in the jaw, poor healing of the jaw, eye pain, dull, aching pain in the hips, groin or right. Taking a bisphosphonate medication such as Alendronate for osteoporosis may increase the risk that you will break your thigh bone. You may feel pain in your hips, groin, or things for several weeks or months before the bone break, and you may find that one or both of your thigh bones have broken even though you have not fallen or expected our trauma. It is usual for the thigh bone to break in healthy people, but to people who have osteoporosis may break this bone even if they do not take alendronate. Take your doctor about the risk of taking alendronate. Alendronate may cause other side effects. Call your doctor if you have any usual problems while taking this medication. What should I know about the storage and disposal of this medication? Keep this medication in the container it came in tightly closed and out of reach children. Store it at room temperature and away from excess heat and moisture. Do not freeze alendronate solution. It is important to keep all medicine out of sight and reach of children, as many containers such as weekly film, windows and those for eye drop, creams, patches and inhalers are not child resistant and young children can open them easily. To protect young children from poisoning, always lock safety caps and immediately place the medication in a safe location, one that it up and away and out of their sight and reach. Unneeded medication should be disposed of in special ways to ensure that pets, children, and other peoples cannot consume them. However, you should not flush this medication down the toilet. Instead, the best way to dispose of your medication is through the medicine take back program. Talk to your pharmacist or contact your local garbage recycling department to learn about take back program in your community. See the FDA Safe Disposal of Medicine website for more information. In case of emergency, overdose. In case of overdose, give the victim a full glass of milk and call your local poison control center. And victim has collapsed or is not breathing, call local emergency service at 911. Do not allow the victim to lie down and do not try to make the victim vomit. Symptoms of overdose may include in the following: heartburn, nausea, stomach pain, bloody vomit or vomit that looks like coffee ground, difficulty swallowing or pain when swallowing, bloody or black and tarry stools. What other information should I know? Keep all appointment with your doctor and the laboratory. Your doctor may order certain lab tests to check your body's response to Alendronate. Do not let anyone else take the medication. Ask your pharmacist any question you have about refilling your prescription. It is important for you to keep a written list of all of the prescription and non-prescription medicine you are taking, as well as any products such as vitamins, minerals, or other dietary supplement. You should bring this list with you each time you visit a doctor, or if you are admitted to a hospital. It is also important information to carry with your care of emergencies. Brand name Binosto, Fosamax.